We are now approximately 6 months from our last procedure for this young lady. She has had 6 years of pain in the right foot after a very complicated bunion procedure that was complicated by non-union of the bone, requiring multiple procedures from one of our orthopedic colleagues, who fortunately was able to fuse that toe and obtain healing. But unfortunately, the patient continued to have severe pain in her right foot, especially into the big toe and into the arch of the foot. Can you please explain to us a little bit about what that pain was like and what it did to you over the past few years?
It was just a very intense pain, burning, shooting. It was so bad at times that I wasn't able to take a shower. I had to cover my foot with water because just shower water would hurt it. And it essentially stopped me from working. I was on a high level of narcotic pain medicine, and it basically stopped my life. I really didn't do anything for 3 years.
So you said something very interesting that most people may not pick up. You said the water just from the shower alone would hurt. Was that like a burning pain, electric pain? What kind of pain would you
I would say from the shower is kind of like an electric pain. And it would just send me into a tailspin.
So what about bed sheets or socks and shoes? How would you wear those?
Very carefully. Anything, even just a simple top cover and a bed sheet would, if it hit my foot, it would immediately wake me up, and I'd be almost in tears just from the intensity of the pain. And so everyday living was hard. It was very difficult. Okay,
so this is a complex foot 303 here. To help her with that, with this toe, we did remove the superficial perineal and deep perineal nerves so that this area would be numb to touch. Unfortunately, that's helped her very much, where she used to not be able to touch this at all. Now we can touch it and be gentle with that. And then on the inside of the foot, very complicated procedure where we did remove nerve branches because they were already injured from numerous surgery and scar tissue to the inner great toe and also into the web space between the two. And those nerves were implanted into this arch right here. But then after an accident, her pain came back about a year ago, and we had to remove these nerves again and do something a little trickier. And again, these were buried deep into the arch of the foot with a nerve graft on the end of it, and we did a tarsal tunnel release in the ankle. And while these scars may be fairly substantial, tell me, now, would you trade those scars off again if we could get you back to where we are today?
Yeah, I would take about 100 more of them.
All right. So tell us what's happened over the past 6 months you've been able to do. Are you still taking any narcotics at all?
No, I'm finally off all narcotics, which is huge because I was on a super high level of narcotics. I've been able to go back to work full time. I've been able to have a social life again and enjoy my friends and family. I've been able to work out, which is something I haven't been able to do in a long, long time.
Yeah, so this was a little bit of a team effort. We had the help of a good pain management team who was helping you come off some of those medications and support you through that. Some wonderful physical therapists who helped you through this. And fortunately, you healed well.
Yeah.
That made my life easy. So overall, I'd say this is fairly successful. What would you say?
100%.
All right. How much relief of your pain do you have, do you think? I didn't ask that question.
I would say about 95 to 99%.
Now, that's pretty good.
Yeah, it's amazing.
All right. Thank you very much.
Thank you.